Here again with Coffee and Conversation, I'm Shashank Bengali, your host, and Seth Schoen from the Electronic Frontier Foundation is joining me to talk about privacy and public health during the pandemic.
Thank you, Shashank. It's wonderful to be here.
Here in Singapore, we've been having a debate about a Bluetooth technology that allows for exposure notification and some degree of contact tracing, where if you have a Bluetooth app activated on your phone, it will tell you whether you've come into proximity with somebody who has a known COVID-19 infection. The government's tried to justify this by saying it's Bluetooth technology that's being used, it's not location data that's being collected. And of course, they've made various pledges about when the data would be deleted after 25 days and not used for any other purpose. But I wonder if you could, using that maybe as one example, talk us through some of the technologies that might be seen as less intrusive, or some ways that governments can go about collecting important data for health reasons without getting too deep into some of these privacy problems we're talking about.
Well, this debate has been huge all around the world, I'd say, because there are so many different models for how we could do exposure notification. And unfortunately, we don't really have a lot of empirical experience with the consequences of these different kinds of technologies, in the sense that we haven't had earlier epidemics and we haven't had really that much research prior to this outbreak about how well the different approaches perform in practice. That obviously hasn't stopped researchers from hurrying to try to come up with clever ideas that may work, that may help. As we've said, none of those ideas have really been proven. A lot of them have a lot of inherent plausibility, but we just don't have a lot of data because it's so new and it's moving so quickly. As I think you've seen in Singapore, as we've seen also in Europe and elsewhere in the world, there are different groups that are proposing slightly different models. And I know that the Singapore government rolled out an app and then was frustrated that on iPhones it wasn't able to access the Bluetooth sensor when the app was running in the background, and so it doesn't collect information as frequently as the government expected. A lot of the app concepts and device concepts that have emerged are trying to use radio to tell when particular people are nearby one another without necessarily identifying one another using their legal identity or telephone number, but just potentially saying, well, these two phones identified with code numbers were near each other at some point because they were able to see each other over a radio signal. There are also proposals that use high-frequency sound in place of radio there. And Bluetooth is a short-range radio-based technology that may work for that. Researchers haven't really been able to prove how relevant the proximity of one phone to another will prove to be in terms of the likelihood of exposure. There are counterexamples that are concerning. For example, if people were separated by a window, like a car window, the radio waves might still propagate well, but the air didn't propagate, and so the people probably were not actually exposed. Or, for example, people who live in the same apartment building, who might be separated by a wall or a ceiling, might still see one another's radio signals, and so an app might conclude that those people had exposed each other. But that's not currently thought to be a very high likelihood if those people are constantly separated by the wall, right? But of course, you can see other people's Wi-Fi through the wall. That doesn't necessarily mean you can catch a virus from them through the wall in the biological sense, maybe in the data sense. Yeah, and then there's been controversy. It was a very intense controversy in Europe because there are several different projects that proposed different data models in terms of, if we do track this, where does the data go? Who stores the data about which devices were in proximity to each other? And at a very high level, there was a controversy about centralized versus decentralized. Perhaps all of the devices could send their records of exposure to a government entity, or perhaps they could just store them inside the devices themselves and not upload them. And in that case, when there was a diagnosis, information might be extracted from the device itself, but there wouldn't be a single database that said, these are all of the people in this country who have been near each other today. That debate has been pretty heated. It has also been complicated, and I know that the Singaporean government had opinions about this, and the UK government had opinions about this, because the major smartphone vendors expressed that they wanted to see particular kinds of privacy controls. So Google and Apple said that they had a particular policy about how they thought this ought to be done, and that they were going to facilitate doing it in a certain way with apps, but not in another way. And so that tended to please some of the researchers who were advocating one model, and irritate researchers and governments who were advocating another model that was less compatible with what Google and Apple proposed to do. It would have been great if somehow this had been a big area of academic research for 5 or 10 years with different university groups doing different trials somehow and really thoroughly studying everything. But of course, there's been, in this crisis, an attempt to roll things out very, very fast. We haven't really had a lot of time to have an elaborate debate or to really test some of the properties of some of the models. I know that Singapore is now experimenting with a wearable device, partly on the basis that not every Singaporean has a smartphone. I've also heard that that's going to be made available to some engineers for review of the privacy and security properties, including one colleague of ours. You know, it's always a good thing to have transparency about how these things work and what they really do or don't do, especially when governments are so concerned about rumors about every aspect of the COVID crisis. It's great to see when governments say, okay, if we're going to do something that involves data collection, we're going to encourage transparency and independent review and publishing the design or the details as far as possible, and encouraging people who have the expertise to study that, which may be some level of antidote to the alternative of having people say, I heard that this device talks to satellites and tells who your friends are, and someone else saying, I heard that this device uses sound waves to tell when you're nearby someone. And so, you know, there are so many misunderstandings about all of these different technologies, which isn't surprising because many of the technologies exist somewhere in the world. They just might not be the exact way that a particular country's approach works. I think, again, there's just sort of the tragedy in there are a lot of great ideas. There's a very limited amount of evidence about how well any of them actually perform. And there really are some different models that are in contention about where should the data be kept, who should control it, who should be able to determine the identities of people who have had an apparent exposure event, and all of those kinds of questions.
That's a really thoughtful point to end on. We've really appreciated all your insights, Seth, and thank you so much for your time. It's all the time we have for this episode of Coffee and Conversation. I'm Shashank Bengali. Please join us next time.